12 alarming black men's mental health statistics. Black adults in the U.S. are 20% more likely to experience serious psychological distress than white adults. Yet black men are far less likely to receive treatment. Only about 26% of black men with mental health conditions receive treatment compared to 45% of white men. This gap exists because of stigma, mistrust in healthcare systems, and lack of culturally competent providers. Black men are more likely to be misdiagnosed with schizophrenia compared to other groups. Symptoms of depression or PTSD in black men are often misinterpreted as psychosis or aggression. Black men are overrepresented in suicide rates among youth and young adults. Suicide rates for black boys aged 10 through 19 rose 60% between 2001 and 2017, one of the fastest increases among any demographic. Homicide is the leading cause of death for black men ages 15 through 34. While considered a criminal justice issue, it's also a public and mental health crisis due to community trauma and PTSD. Black men are significantly less likely to be referred for mental health services by primary care providers. Biases in healthcare settings lead to underdiagnosis and undertreatment. Nearly 80% of black men who experience mental health symptoms never receive professional help. Community stigma and lack of resources often leave them isolated. Unemployment and under-unemployment rates for black men are consistently double that of white men, contributing to chronic stress and depression. Financial instability directly impacts mental well-being. Incarceration rates for black men are 6 times higher than for white men in the U.S. The trauma of incarceration and its after effects on mental health devastates families and communities. Black men report higher rates of discrimination, related stress than any other racial group. Daily encounters with bias, microaggressions, and overt racism contribute to chronic anxiety and depression. Black men are far more likely to drop out of therapy after the first session. Mistrust of mental health professionals, lack of cultural understanding, and ineffective care are key reasons. Black men are less likely to be prescribed evidence-based treatments for depression and anxiety. When they do receive care, it's often not tailored to their unique cultural and social experiences, reducing its effectiveness. Why this matters? Black men's mental health is a crisis hidden in plain sight, buried under the layers of systematic oppression, stigma, and institutional neglect. These statistics highlight the urgency needed for culturally competent, accessible, and community-rooted mental health services for Black